Good morning, everyone. Today is Thursday, August 16th. Thank you so much for joining into our weekly healthcare reform webinars. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. For those of you that are new, my duties include overseeing the traditional group markets, reference-based pricing, level-funded groups, the ancillary lines, as well as short-term medical and what is left of the individual markets in the state of Pennsylvania. If you are new to this format, I review federal legislation that affects not only Pennsylvania, but us nationally, and also state legislation within the Commonwealth of Pennsylvania. Questions are encouraged. That helps us learn and helps us research the answers that we don't know so that you can be a better resource to your clients. So with a show of hands, if you could just let me know if you can see me, see the screen and hear me okay. Great, awesome. That's also how you can ask questions. If you want to ask questions live, you can put up your electronic hand, or you can type questions into the question box and I'll answer those at the end of the webinar. So let's just get started. A lot of this is some review from last week, but still very much on everyone's mind. Certainly the short-term medical, the expansion to allow for 364 days versus 89-day max. That is pretty darn exciting from my perspective. It's going to give consumers another option. Of course, there are heavy disclaimers if you're writing these products that you must adhere to. All the websites will have the disclaimers on it, but they are not to be sold as a replacement to an ACA plan or be promoted as something equivalent to an ACA plan. So if you can adhere to those guidelines, then I think it's a really great opportunity, not only for January of 2019, when everybody is looking for health insurance and has to renew their individual coverage. And of course, in 2019, the individual tax penalty is zeroed out. So these plans, although they're not qualified according to government standards, there's no tax penalty for having these plans. Also, I see a big opportunity, and again, I'm not encouraging it, but towards the end of the year, there are a lot of folks that are on an individual plan, either on the marketplace or off the marketplace, that could look at these plans for the last 2 months of the year, because if they've not had another break in coverage and received an exemption for that, they could essentially choose these short-term medical plans for the last couple months, and even though the penalty stands for 2018, could get that one-time exemption for not having coverage. So I hope that makes sense to all of you health insurance nerds that are listening. If not, just reach out to me and I'll explain. So speaking of the FFM, 2019 FSM certification is out there. You can access those links for your certification through portal.cms.gov. There are two choices: the AHIP module, if you have done your AHIP through for the Medicare and paid for that, there is still a separate fee for this particular AHIP test. So if you were going to ask that question, the answer is there. There are some CEs in various states available with the AHIP testing. Of course, the MLMS test is free. That's the one we've been doing the last several years. And for those returning agents and brokers, it's very limited in what you actually are required to do. I believe the requirements, and I did it, but I think there are 3 modules. One of those is a test, and then 2 security agreements. So very, very, very easy to get through. Remember, even if you're not planning on selling or don't have any product to sell in your state, if you do have renewals, you will want to do the FFM certification to capture those renewal compensation checks. And of course, our carrier in Pennsylvania, Highmark, for Central, East, and West, do require that you have your certification through the FFM, even if you're selling off marketplace. They have an additional certification, and that's not been released yet. So I will pass that on when we get it. Senators Angus, King, and Marco Rubio introduced a bill to fix the Social Security loophole for subsidies. If somebody qualifies for Social Security income, it comes because there's a delay in receiving the payments, it comes in a lump sum, which could adversely affect some of those folks that are subsidy eligible. So they are introducing a bill to prorate that lump sum so it would not adversely affect any subsidy eligibility. On to carrier updates. We talked about this last week. Effective for 10/1 effective dates, all small group, level funded, and mid-market will be subject to medical underwriting. They're saying if you add CBC Dental to a new or renewing group beginning with a 1/1/19 effective date, they will receive a 2-month premium holiday. So that's a good bonus. I've also attached just a white paper on all of the bonuses that are going on in the group health market. Also, the Colonial Life and URL Jumpstart bonus, that flyer is also available attached to this webinar. So hopefully you'll take advantage of some of those bonuses. Speaking of kind of a bonus, at an early submission, the group will get an administrative credit of $25 per subscriber for early submission. So on our group resource page, you'll see the cutoff dates. You'll want to make sure that you adhere to those to get your clients some administrative credit. I already talked about the bonuses. Please take advantage of those. Your new business specialist will be pushing that and making you aware of when you're selling a group, what bonus you would be eligible for, just to kind of help incentivize you and keep you excited through this god-awful fourth quarter that is upon us. So hopefully you'll be able to earn some extra revenue for all of your efforts. Upcoming events, September 5th, we are almost full for the Medicare Connections Conference. It's at Hershey Lodge. This is an annual event, very, very well attended. If you are in that Medicare market, I can tell you that it's imperative for you to get there because the information that you get in a day's worth of your time is incredible, and it's going to help you prepare for your sales for your annual election and then the open enrollment period after your 1/1s. Also, September 13th, from 7:30 to 5, CPHU, Central Pennsylvania Association of Health Underwriters, is holding their first Medicare Summit. It's at the Holiday Inn East. It is $49 for you to register if you register before the 30th of August and $59 thereafter. There are some speakers that are lined up, so if you want to attend both, that would be a great opportunity to learn different things in those Medicare segments. So before we get to the open discussion, next webinar is Thursday, August 23rd. I am going to have a guest speaker on September 6th, Able Pay. The Able Pay summary is also attached, and this we just met with them, and I think it's a pretty interesting concept. What they said is that the average hospitals and providers are reimbursed about 35 cents per every billed dollar. And this acts almost like a secondary insurance, although it is not insurance. It's really a secondary payment plan. This organization negotiates with the hospitals, and they also offer some payment options that a person could better budget and better pay those bills from deductibles and co-insurances. So I've probably done a terrible job of really kind of giving you a recap, but the flyer is there. September 6th, we'll have the guest speaker, and they're going to do about 5-10 minutes on this opportunity. It is commissionable, and it's very prevalent right now in the Lehigh Valley. hospitals are participating with it. The word is out, and it's heading west. Lancaster General is another segment, probably for fourth quarter, most likely for fourth quarter. That could be an opportunity. And of course, they're moving west and hopefully can get affiliated with some of our local hospitals here centrally and northeast and west. So hopefully when you're on the webinar, you'll find that interesting and something that your clients would benefit from. It's absolutely free to the employer, absolutely free to the employee. Another event that we talked about tonight, if there's still time, we have about 60 cars coming, and we are having an event, a Back to the Future event at Harr's Drive-In. Doors and gates open at 7, and then the movie will begin at dusk. There will be trivia, some prizes. The concession stand will also be open, and the food is courtesy of URL. So if you want to go to our website and have some time this evening to come and join us, we certainly welcome you and hope you attend. So let's get your questions in and see what we have. Mike says, with all the warnings out there for short-term medical plans, any recommendation for a signed and legal disclosure of the facts that the experts are warning against, despite the Pennsylvania State Insurance Department approval of the plans? I would say, Mike, it's probably not a bad idea. I think the trouble with that is you may not be able to list all of the exemptions, and omitting one of the exemptions might indicate that it's not an exemption. So I don't think it's a bad idea, but I would be careful on your wording. Certainly I would maybe even just print the disclaimer and have them sign the actual disclaimer, as opposed to coming up with something that might better suit your purposes. So I know that's not really an answer, but I know where you're going, and I think the disclaimer itself might be a good idea. That tends to be it. No more questions today. So as always, I truly appreciate everyone joining in. Keep your questions coming. You can reach me on my phone or www@urlinsgroup.com. As always, I appreciate you joining in and taking time to be that resource for your clients. And as always, I wish you a great balance of the week and a wonderful weekend. Bye-bye.